support clinic systems participating in CCSP with understanding their capacity to sustain the patient navigator role and services, as well as to support them with building capacity for sustainability of those roles. The Colorado Cancer Screening Program adapted the sustainability tools that were developed by Washington University in St. Louis, the Program Sustainability Assessment Tool and the Clinical Sustainability Assessment Tool for use with patient navigation services and patient navigation programs. And so CCSP developed a hybrid version that pulls in elements from both tools. Most of the domains of the Clinical Sustainability Assessment Tool, as well as the funding stability and communication components of the Program Sustainability Assessment Tool. This adapted version of the tool is called the Patient Navigation Sustainability Assessment Tool. It contains 8 domains, each which have 4 rating questions that are on a 1 to 7 scale in order of the capacity to sustain those elements or the capacity of those elements in a program. So all of the participating clinic systems in CCSP completed that PNSAT tool to understand their capacity to sustain patient navigation, especially for colorectal cancer screening, as well as other interventions or initiatives that their patient navigators are focused on. And through use of that tool, got to understand some of the areas where clinic systems have many strengths, which can be things like engaged staff and leadership, organizational capacity, some areas that need additional support like funding stability, as well as workflow integration, ensuring all of the components of patient navigation are in the workflows and job descriptions, looking at evaluation, as well as communications and training. And so CCSP piloted those tools with all of our clinic systems and then also expanded with use with other patient navigation programs at the national level, including the National Navigation Roundtable, the American Cancer Society here in Colorado, and nationally as well, to really understand capacity and what steps could be taken to improve that capacity. The steps that clinic systems and other patient navigation programs take to really utilize that PNSAT tool is to bring together a group of 3 to 5 individuals to each complete the assessment from their individual perspective of their role. We recommend having a wide variety of roles who are directly involved with patient navigation complete the assessment. So that can be the patient navigators, their supervisors and other leadership, quality improvement specialists, and even other administrative roles that really support patient navigation. After each individual completes the assessment, they receive a copy of their results, and then the group will come together to discuss those results, including the successes, some of those opportunities for improvement, and really thinking about, are there 1 to 2 domains of the PNSAT where there could be some action taken to strengthen capacity in those areas to move towards sustainability. We know that clinic systems, there's some areas where they feel like there is things they can address and really take action. Some of those areas were workflow integration, as well as really ensuring that there was regular training for patient navigators, but that needed some additional support from the Colorado Cancer Screening Program to move that work along. So we would meet with them at least quarterly to review their plan, how implementation was going, where they need support, ensuring we're bringing in those resources for workflow development, and that really clinic systems felt that they really did need that external support from CCSP and would not have been able to take those steps on their own. But after going through that planning and implementation process, all clinic systems felt like they had at least moderately increased their capacity for sustainability within the areas that they were able to address as a team, but still need some external support in ensuring that there is funding resources for them, and ensuring that those areas that they're focusing on in their sustainability plans can continue to receive attention and strengthen as they continue their patient navigation work. From supporting all of the CCSP clinic systems with developing and implementing a sustainability plan, there were several best practices and lessons learned that emerged. One of those includes really reiterating that sustainability planning is an ongoing iterative process without a specific end date. So needing to continually reevaluate and work a sustainability plan and keep focus on sustainability is really important, because even if you're able to strengthen in some areas, if you retake that sustainability assessment on at least an annual basis, you can see where there has been some movement, but there might be some other areas where there now is either opportunity or need to really put some attention behind and continue focus on some of the other sustainability domains. So we really encourage anyone using a sustainability planning assessment to reevaluate their capacity at least annually. It's also really important when working through a sustainability plan to make sure you're regularly meeting with the sustainability planning team to look at progress, successes, barriers that have emerged, and how they can continue to support the work and keep attention on sustainability planning.